Hello and welcome back to the Arbor Men's Health Show. I'm Dr. Mystery, your host, joined as always by my wonderful co-host, Donnelly.
Hi, everybody. Thank you so much for joining us again. And really, really thank you for sharing this with your friends so that we can go viral. The virals.
It's one of the very few times that I'm in favor of viruses in our practice. Most of the time, these communicable diseases are something that we're trying to avoid. I'm a
Mm.
board certified urologist. The show is brought to you by NAU Urology Specialists. We handle everything between the nipples and the knees. I think you're going to find our practice, if you become our patient, to be one of a holistic nature. We really care about the whole person, the whole body. We have amazing, unique dimensions to our practice that you won't find in almost any other urologic practice. Donna, how do people become patients of ours?
You call us at 512-238-0762 or visit our website, armormenshealth.com. And you can also submit your questions there. We'll answer them anonymously. With the previous question we had about prostate cancer, I thought was fascinating. And I think we're going to talk a little bit more about that.
I mean, a lot of what I do in my practice is prostate cancer, and I would say that many urologists deal with prostate cancer on a daily basis. There are over 300,000 men diagnosed with prostate cancer every year. September is generally considered Prostate Cancer Awareness Month, and that's where you're going to see and hear a lot about prostate cancer. You're also going to see a lot about it during June when we have Men's Health Month. But the PSA screening, which is a blood test that looks for your risk for prostate cancer, is generally done by your annual exam. I think the guidelines have people getting screened between the age of 50 and 75, and African American men generally a little younger, people with risk factors a little younger. But that's global community wide recommendations.
Mm-hmm.
You know, if you went to your car mechanic and he was just giving you the treatment that he gives everybody with a car, it may not be the personalized care that you want for yourself. And so, in my practice, I don't use age-based cutoffs for when people get PSA screenings or biopsies or anything for prostate cancer. I want to look at the person.
Mm-hmm.
Not all 55-year-olds are the same. Not all 75-year-olds are the same. Increasingly, I'm getting 75-year-olds whose parents live till 95 or 100. They look amazing. They're not on any medicines. They have a 20-year life expectancy. This is different than a guy who comes in on oxygen, with a walker, who looks like he may not make it out of the parking lot. And so
Mm-hmm.
that's a different kind of patient. So we try to use different strategies, different guidelines for people when we get an idea of their overall health. Now, of course, we don't have a magic ball. We don't know how long you're going to live. But with modern medicine, people with even advanced chronic diseases, live longer and longer. I mean, Donna, do you expect to live another 30, 40 years?
Gosh, I hope so. But I remember this makes me remember a conversation I had with my dad when I was younger. And he said something about being 30, somebody was 30 something. Well, they're middle aged. And I was like, that's that's not middle age. Like that's 30. Isn't like 50 middle age? And he goes, how many people are living to 100, Donna? And I was like, oh, so that makes sense. But I hope to live to 80, a healthy
Yeah.
80, not an unhealthy 80.
And we want to help people age well. But what I try to tell people is even though there may only be, less than 50,000 men that are dying of prostate cancer every year, those are
Mm,
terrible deaths. And
mm,
it's a tremendous loss of quality of life. The treatments that we give you take away all your testosterone, all your hormones. We take away
mhm.
your sex drive, make you impotent, can make you lose your muscle mass, make you feel weak. I think if anybody out there were to speak to somebody on hormone ablation for prostate cancer, they tell you that they feel terrible. And
Mm,
so trying to avoid people getting to that stage is really where we spend quite a bit of time in our practice. Deciding who gets advanced testing and who gets a biopsy, I think, is really important. And, for our listeners out there, they should just be reminded that the philosophy of the doctor will say a lot about how you get tested and treated and the capabilities of the doctor. So, if you go to a surgeon who does robotic prostate removal, who has advanced skills, you may get offered a more aggressive approach to your biopsy and to your treatment. If you go to somebody that doesn't do that anymore, then you may get less aggressive treatment. If you go to somebody who owns a radiation machine, don't be
mhm.
surprised if you're offered radiation.
Right. That's
We
weird.
do
That's unsettling.
high intensity focused ultrasound, and so we do a lot of HIFU treatments for prostate cancer. Now, I'm only one of a handful of urologists in this country that do HIFU because we have machines here in Austin that can deliver it. We have two, in fact, here in town. And I have hundreds and hundreds of cases of experience doing this minimally invasive way of treating prostate cancer. So instead of removing the prostate or instead of radiating the prostate, what we do is we use ultrasound energy, sound waves, to kill or to heat up the prostate tissue to give you death of where the cancer is. This does not cause damage to surrounding structures. It does not cause radiation effects that can lead to secondary cancers. It generally can be done without causing you impotence and incontinence. And it sounds like, God's gift to prostate cancer. It doesn't work as well as removing the prostate. So there's always something that,
Mm.
doesn't, there's some trade off when it comes to these things. But that's what we like to discuss with patients, what that trade off is.
Hmm.
Uh, Donna, prostate cancer has affected members of your own family.
Yep. I've had my father-in-law has had the HIFU procedure, high intensity focused ultrasound, and he's also had prostate artery embolization. Sometimes those two work hand in hand because the PAE procedure shrinks the prostate, right? And
That's
it
right.
makes it easier for a different procedure.
So both prostate artery embolization and our use of high intensity focused ultrasound really illustrate kind of the cutting edge nature of the kind of medicine that we practice.
Hmm.
Even the largest urology group in Austin does not offer this combo therapy. And as a matter of fact, I would say that very few, if any, large urology groups in the entire state of Texas offer prostate artery embolization, where we take and we cut off the arterial flow to the prostate, shrinking it. Now, we do it in the case of enlarged prostate so you can pee better. We like to make America pee again. But we also use it to downsize or to shrink the prostate prior to radiation therapy or prior to HIFU. Now, high intensity focused ultrasound is an outpatient procedure. It involves the placement of a probe into the rectum. We visualize the prostate. We use ultrasound energy or sound waves to kill part of the prostate. We can actually see the prostate while we're doing it. We can see the changes in it, so we know that the treatment is effective. We can actually map your prostate with an MRI, so we can specifically hit points of the prostate. What's even cooler is in our practice, we keep track of where your biopsy is done in your prostate, and we can overlay that image onto the HIFU image so we can very specifically treat exactly where you have cancer. It is remarkable medicine that I never would have imagined 20 years ago when I was training. And we're very fortunate to be able to offer those kinds of treatments to our patients.
Can you imagine your younger self telling your younger self, hey, guess what minimally invasive procedures we're going to offer in 10, 15 years?
Well, it's a very good point. When I trained, I trained to become a surgeon. So to cut is to heal. That is kind of what the mantra that we were raised on,
Hmm.
and becoming a surgeon does require operating quite a bit. And I think I'm very proud of the training that I received at Baylor College of Medicine. For 11 years, I was on the slow program, I guess. But that training of how to become a surgeon, they you spend a lot of years learning how to operate, and then you spend a lot of years learning when to operate.
Hmm.
So, and those two skill sets are different because you want to make sure you're operating on the proper patient that will benefit from what you do. High intensity focused ultrasound is something that we offer that's covered by insurance. We
Hmm.
can generally target it so that we do not cause impotence and incontinence. It's a minimally invasive way of treating your prostate cancer. Many patients will think that surgery, because it's surgery, that means that we're cutting on you. But in fact, we don't even cut on you. We go through all your natural orifices. You have to come in
Mm.
to find out which natural orifice I'm talking about this time.
Oh,
Uh,
sounds like a
but
Friday night at my house.
oh boy, uh, maybe maybe 30 years ago, Donna.
Yeah, there's that. I have a quick question before we end this segment, but I'm just wondering about the largest prostate you've ever done a surgery on to remove.
Well, when I was in training, so a normal prostate's 30 grams, a little
The
bit bigger
walnut.
than a walnut,
Hmm.
and then a big prostate, so something that I would say, man, that's a pretty big prostate, would be the size of an orange, maybe 150 to 200 grams. But we've done a 700-gram prostate for prostate cancer when I was in
Ooh.
training. Now, that patient had a terrible disease and probably didn't do very well, but
Oh.
still, it is what we did.
How
Today,
much is a
fortunately,
700 gram? Like a grapefruit or
it would
water
be
small watermelon?
it was like 2 grapefruits, it was humongous.
Ooh, poor guy.
Yeah,
Mm,
poor guy.
mm.
So, if you're interested in getting your prostate cancer checked, your prostate cancer risk checked, and most importantly, if you've been diagnosed with cancer and you have not had a second opinion, treat yourself to a second opinion here at NAU Urology Specialist. Donna, how do people do that?
You can reach out to Dr. Sandeep, Second Opinion Mystery, at 512-238-0762. You can visit our website for this show, armormenshealth.com. And you can visit us in Round Rock, North Austin, South Austin, and Dripping Springs. Thank you guys so much for listening. Thanks, Dr. Mystery.
Thank you, Donna. All right, Donna, I'm going to